Well, May is Mental Health Awareness Month. Teens make up a large population facing mental health issues, as more than 13% of teens are diagnosed with depressive disorders each year.
Joining us now to talk about a local clinical trial to help teens with depression is Dr. Huma Khan, adolescent medicine physician with Advocate Healthcare. Thanks for being with us, doctor.
Thanks for having me.
All right, let's talk about the goals of this clinical trial. What are they?
So the primary goal is prevention. What we know right now is that over 13% of teens are diagnosed annually with depression in the United States. So prevention is a big deal. And what this study is doing is it's looking at a computer-based program that can possibly prevent depressive disorder in teens.
Okay, and so one of the things that you have found is that there's this high percentage, or 13% of teens are diagnosed, but only 40% are actually receiving treatment. So talk about the type of treatment that they're getting and what's behind sort of this gap, why they're not seeking help.
Yeah, that's a great question. There's so many reasons why there's this gap. There's a lack of access to care. So that's why prevention is so important. What the Catch It program does is it teaches kids early on in the stages of depression of how do we deal with a negative mood? How do we deal with really stressful situations at home or at school? So that's what I think is so great about this study is that we're working on prevention rather than treating something that's already really severe later on.
Yeah, so teaching them early on things to look for.
Yes.
Yeah. So your goal, you talk about an online behavioral vaccine. What does that mean exactly?
Yes, it's a behavioral vaccine. Catch It is a self-directed computer-based program. And just like other vaccines prevent disease, this is also meant to prevent disease, depression being the illness.
Okay. I want to talk a little bit more about what teens are going through right now. Obviously, they're coming off of the pandemic. They've had a lot to deal with. Other than these studies and these other tools that you're using to treat and prevent some of these depressive disorders, what advice would you give to a family, a parent who maybe thinks that they may be dealing with something like this?
Yes, in my opinion, I think this really should start at home. I think having a open conversation with your child, creating an environment at home that is safe, that is welcoming, where you can talk about difficult subjects without fear of repercussion or judgment. So I think opening this conversation at home, normalizing mental health in our conversations with our children.
And it's not always a medical treatment that's necessary for teens with depression, right? Or I should say not medicine.
Right.
What are some of the other options? I think that can be intimidating to people.
Yeah. Right. So this study is not about medicine. It's about teaching coping skills, life skills, and doing that early on so people can better deal with stress in their life, have better coping methods. And that's what Catch It is all about.
Okay, so if somebody's interested in being either a part of the study or learning a little bit more about the results, where should they go? What should they do?
So what they can do is you can first of all talk to your pediatrician if you're concerned about your child's mental health. You can also go to www.advocatechildrenshospital.com and find a doctor and schedule an appointment.
Okay. Thank you so much, Dr. Huma Khan. We appreciate your time.
Thank you.